Hand, foot, and mouth disease. Lesions in hand, foot, and mouth disease are maculopapular and partially vesicular rash on the hands and feet, oral ulcers. Definition of hand, foot, and mouth disease. It is highly contagious infection that manifests with a characteristic maculopapular or partially vesicular rash on hands and feet. Epidemiology. It occurs in all age groups. Highest incidence in infants and young children less than 10 years of age. Etiology. The etiology of hand, foot, and mouth disease is Coxsackie virus A infection. Transmission. Transmission is through airborne droplets, fecal-oral route, direct contact with the lesion, fomites. Infectivity. People with hand, foot, and mouth disease are usually most contagious during the first week that they are sick. However, people can still sometimes spread the virus to others for days or weeks after symptoms go away, or even if they have no symptoms at all. Clinical features of hand, foot, and mouth disease: fever, malaise, maculopapular and partially vesicular rash on the hands and feet. It can also involve the buttocks, oral ulcers, anorexia, oral pain. Diagnosis is based on clinical features. Treatment is symptomatic. Prognosis: this disease is almost always self-limiting. Hand, foot, and mouth disease. Soles of the feet of a child. Macular vesicular lesions on an erythematous base are visible on the toes and the soles of the feet. Macular lesions, vesicular lesions. This rash is typical in the hand, foot, and mouth disease. Skin lesions in hand, foot, and mouth disease. 12-month-old infant. Typical white-gray blisters with a diameter of approximately 3 to 5 mm, surrounded by an erythematous halo, are seen on the fingers. White-gray blisters. White-gray blisters. Another common finding as seen here is a disseminated maculopapular rash on the upper and lower legs. Maculopapular rash. In addition, there is a partially crusted papulovesicular rash in the perioral region. Partially crusted papulovesicular rash. However, the eponymous involvement of the mouth refers to the typically painful aphthous inanthum of the oral mucosa, which is not shown here. Hand, foot, and mouth disease. Hands and feet of a 36-year-old male patient. Maculopapular lesions are visible on the inner surface of the hands and feet. Maculopapular lesions. Maculopapular lesions. The localization in conjunction with the inanthum of the mucous membranes is typical of hand, foot, and mouth disease. The characteristic vesicles are not frequently formed in adulthood. Hand, foot, and mouth disease. Mouth and the tongue of a child. There is an ulcer on the tip of the tongue, which is uncommon in hand, foot, and mouth disease, which usually manifests with lesions around the lips and or the back of the throat besides the hands and feet. Thank you.